What causes asymmetry after male breast reduction surgery? Imagine stepping out with a flatter, more masculine chest, only to notice that one side looks slightly different from the other. That's what we call asymmetry after male breast reduction surgery or gynecomastia surgery. While the goal is to create a balanced chest, several factors can lead to uneven results. Let's explore what might cause this. First, many men have some natural differences in their chest shape before surgery. One side might have a bit more glandular tissue or fat, or the nipples might sit at slightly different heights. If these differences aren't fully addressed during surgery, they can remain or become more noticeable afterward. During the procedure, the surgeon removes excess tissue and fat from both sides. Sometimes, the amount removed isn't perfectly equal. Variations in tissue density or surgical technique can make it tricky to achieve perfect symmetry. Even small differences in tissue removal can lead to one side appearing fuller or flatter. Healing also plays a big role. Swelling, bruising, and scar tissue form as the body recovers. These changes don't happen uniformly, so one side might heal faster or differently, causing slight contour differences. Scar tissue or fibrosis can contract unevenly, affecting the final shape. Skin elasticity is another factor. After tissue removal, the skin needs to retract and conform to the new shape. If one side's skin is looser or tighter, or if it doesn't retract evenly, the chest can look asymmetrical. This is especially common if the skin has been stretched for a long time before surgery. Nipple and areola positioning also influence symmetry. If the nipples aren't repositioned carefully or heal in slightly different spots, it can create an uneven appearance. Proper placement and resizing are important steps in the surgery. Certain medical conditions can predispose a person to asymmetry. Conditions like Poland syndrome, where one side of the chest is underdeveloped, or pectus excavatum, which causes a sunken chest, can make achieving perfect symmetry more challenging. These cases often requiring tailored surgical approaches. Postoperative complications such as infection, hematoma, or fluid buildup can also impact the symmetry. If one side develops issues like swelling or scar tissue, it may look different from the other. Sometimes, additional treatment or revision surgery is needed to correct these issues. Finally, changes in weight or hormones after surgery can alter the chest's appearance. Gaining or losing weight can deposit fat unevenly, and hormonal fluctuations can affect tissue and skin, potentially leading to asymmetry over time. To minimize these risks, plastic surgeons plan carefully, measure precisely, and pay close attention to nipple placement. Still, some minor differences are normal and often considered part of individual variation. If asymmetry is bothersome, revision surgery can sometimes improve the balance. It's important for patients to have realistic expectations and discuss their concerns openly with their surgeon. Regular follow-up helps monitor healing and address any issues early. Remember, each body heals differently, and achieving perfect symmetry isn't always possible, but most results are very satisfying. Always consult with a qualified plastic surgeon to understand what's realistic for your unique anatomy and circumstances.